A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant political development, President Donald Trump's proposed healthcare legislation, often referred to as the Big Beautiful Bill, has made its way through the Senate with a narrow 51-50 vote following an exhaustive overnight session. This bill, however, is not without controversy and could have dire consequences for millions of Americans. The legislation is set to enact sweeping changes to healthcare funding, with estimates suggesting a staggering $1.1 trillion cut in healthcare spending over the next decade. The majority of these cuts, over $1 trillion, would directly impact Medicaid, the federal and state program that provides health insurance for disabled and low-income Americans. This could leave an estimated 11.8 million individuals without health insurance by 2034, according to the Nonpartisan Congressional Budget Office, CBO. The implications of this bill extend beyond mere statistics. They threaten the very fabric of the healthcare system, particularly in rural areas where hospitals and health centers rely heavily on federal funding. The CBO has warned that the current iteration of the bill would not only strip millions of their insurance, but could potentially lead to the closure of many rural hospitals that are already struggling financially. The stakes are high, as approximately 72 million Americans currently depend on Medicaid, which serves as a crucial lifeline for nursing home residents and accounts for around 40% of all births in the United States. In the face of these cuts, the Trump administration and its supporters assert that the bill aims to eliminate waste, fraud, and abuse within the Medicaid program. However, critics argue that these proposed changes contradict the president's previous promises to protect Medicaid. The debate has intensified, particularly among House Republicans, some of whom are voicing concerns about the depth of these cuts. Jennifer Kennedy, president of the American Nurses Association, expressed her apprehension, stating that while the intention to cut fraud is understandable, the sweeping nature of the cuts could jeopardize the very hospitals and health centers that provide essential care. The bill proposes a new national work requirement for certain Medicaid beneficiaries aged 19 to 64, mandating that childless adults without disabilities and parents of children over 14 must work, volunteer, or attend school for at least 80 hours a month to maintain their insurance coverage. This requirement, which would not take effect until 2026, is projected to save about $325 billion over the next decade, but it raises significant concerns about its impact on vulnerable populations, particularly older adults. An analysis from the UC Berkeley Labor Center highlighted that this work requirement could disproportionately affect older individuals, who may face barriers to employment due to health issues or age discrimination. Additionally, individuals in rural communities, such as seasonal workers, may struggle to find consistent employment, further complicating their ability to meet these new requirements. The bill also seeks to cap and gradually reduce the taxes that states can impose on hospitals and medical providers, a move that critics argue could threaten critical funding for rural hospitals. Kennedy warned that such cuts could lead to widespread hospital closures, exacerbating the already limited access to care in rural areas. Senate Republicans have attempted to address this concern by adding a $25 billion fund to support rural hospitals, but many believe this is insufficient to offset the cuts proposed in the legislation. Meanwhile, the pharmaceutical industry is celebrating a provision in the bill that exempts more medications from Medicare drug price negotiations, a move that critics argue undermines efforts to lower drug prices for consumers. The inclusion of the Orphan Cures Act, which allows drugs for multiple rare diseases to be excluded from price talks, has drawn sharp criticism from advocacy groups who argue that it represents a significant giveaway to the pharmaceutical industry. As the bill moves to the House, where Republicans hold a slim majority, it faces yet another hurdle. The potential fallout from this legislation could be profound, affecting millions of Americans' access to health care and the stability of the nation's healthcare system as a whole. With the stakes so high, the coming days will be crucial in determining the fate of Trump's healthcare bill and its impact on the lives of countless individuals across the country. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.